to shoulder joint motions. Internal rotation and
horizontal adduction.
Horizontal adduction. This is just what the question was asking you to do. So you had your arms out to the side and they had you flex it, and they were trying to get you to horizontally, at the shoulder joint, horizontally AB, trying to give you some type of scapular, concentric scapular AB. So muscles that do this, nice little picture here letting you know these two. Pectoralis minor, it's in the front, in the coracoid process going down to your top ribs, I think it's 2, 3, and 4. So it will bring you forward and do scapular AB, and then serratus anterior, your claw, brings you to the front, from the scapula to the ribs. So it pulls the scapula around to the front of the ribs, so both of these muscles have a rib insertion right along here along the ribs, and they just pull it forward. So these are your concentric scapular abductors. So this is an important part here. These are kind of more of the functional aspects and short answer type of questions that I'm going to ask you. I'm going to, these things that say elbows in and elbows out, I also want you to know them the other way, elbows in and elbows out. But I'll talk about that once we get there. We can work through that. It didn't ask you to do this, but you should be capable of doing it. Rowing stroke. Again, this can be interpreted in many different ways, so I would demonstrate it one way, and you would have to just be able to identify it. So for the rowing stroke, what I was looking for was not the one where you do extension, but the one where it was asking you to pull this way. So this motion at the shoulder joint, if we start here, I'm going to start on the bottom and go back up to the top. If we start at the shoulder joint, this motion at the shoulder joint isn't the same as this. It just looks a little different because the elbows are flexing. But the trajectory of the humerus is exactly the same. It's moving like this. So that is horizontal abduction. This phase is the concentric phase. This phase would be the eccentric phase, right? The returning of the weight back down. So moving concentrically, horizontal abduction, you would want to list these shoulder joint muscles. These are your horizontal abductors. You have 2 rotator cuffs, infraspinatus and teres minor. The only 2 rotator cuffs I actually ask you to know in regards to shoulder joint motions. And then posterior deltoid. Accompanied with horizontal AB of the shoulder joint is scapular AD or retraction, whatever way you want to call that. I usually use AB and AD language, but I'll take retraction and protraction. That's also going to be concentric. If the shoulder joint is doing a concentric contraction, the shoulder girdle is doing a concentric contraction. So this is scapular AD concentrically, then you're going to do the next phase is scapular AB eccentrically. The concentric phase is the trapezius muscles, middle and lower, and the rhomboids. So this phase is the concentric, and the returning phase would be the eccentric. So what range of motion would you put here at the shoulder joint if you were doing the next phase of this? What would you call this shoulder joint motion? Horizontal adduction. And the contraction type would be eccentric. So then what muscle group would you list? A little louder. Little louder. You're doing horizontal AB concentrically, then you're doing horizontal AD eccentrically. Are the muscles going to change? No. It's the same ones. You're not going to list the horizontal adductors because they're not doing the motion. Right? You would list it if that was the concentric, but it wasn't. It's eccentric. And then the same thing would occur here. It'd be eccentric scapular AB, and you would list the scapular ADs. Is that all right? Okay. Let's move on to the next one. A military press. What I was looking for here was just kind of this pure frontal plane motion. So we looked at this. We start at the bottom of the shoulder joint. What motion is this? Was concentric. What's this motion?
Elevation.
Of the shoulder joint? Abduction, right? I'm abducting. It just looks different because my elbows are flexing and extending. same thing as doing this, right? As a shoulder joint. So I lift this up. As concentric AB, you're going to list the abductors of the shoulder joint, listing them here, upper pectoralis major from 90 and above, and then anterior deltoids. Shoulder girdle accompanies AB. The shoulder girdle does the two upward motions as well, which is upward rotation and elevation. Now, if this were something that was on the exam, you would have three little boxes. You would analyze this one, then you would analyze this one, and then you would analyze this one separately. Okay? So your shoulder joint would have its two phases. Your shoulder girdle would then have motion number 1 in 2 phases, and then motion number 2 in the 2 phases. Motion number 1 would be upward rotation or elevation, and motion number 2 would then be upward rotation or elevation. It doesn't matter the order that you put them in, you would just need to acknowledge both of them and analyze them separately. If it's concentric here, it's concentric here. If it's open chain here, it's open chain here. The problem is going to be for you is to identify the muscles. Knowing your muscles, okay? So we do concentric AB. The lowering down would then be eccentric AD. That's elevation concentrically up. It would be depression eccentrically down. It'd be upward rotation concentrically up, and downward rotation eccentrically going down. Yeah? And then you need to list the muscles. Do you need that again?